I'm joined by Alden Lyall, who is up in Mareeba at the moment in Far North Queensland. Alden, thanks for your time, because we know at the moment Aboriginal and Torres Strait Islanders are very worried about what's going on with COVID-19. You're in the health industry for our mob. First of all, can you explain where you are exactly and what's going on with your community?
Okay. First of all, I'm Alden Lyall. I'm working at Mulungu Health Service. We cover the Atherton Tablelands region, which is Mareeba, Atherton and Kuranda. And so those three towns, we're just a tiny bit west of Cairns, about 50 to 70 k's each in separate directions. And we deliver health. And with the COVID-19 crisis or coronavirus, we've got clinical measures, and we're sending things out to families, and our staff are making changes to how they're working and stuff. And we're delivering content on social media through Facebook. I've been, as a media camera operator and stuff, I've been making short videos on isolation, staying safe, staying at home, only going out for necessary things, sanitizing, hand washing. What else? There's a few others that we're also doing through these tough times, and we're home visits, because we're trying to limit people coming to the clinic. So everyone's tested in a like a tent, so they're not allowed access to the clinic unless they're screened and tested first, and then they're sent through to the clinic. And we're limiting patients. So, and people are calling in and making appointments. They can't just rock up. So there's measures and procedures to make sure the coronavirus doesn't spread. So currently, Mareeba has 2 cases, Cairns about 19. I'm not sure the other figures on Atherton, but they're very low at the moment, and we're pretty much controlled because we're up the mountain and we're sort of away from Cairns. So Cairns is a hot spot, and so, you know, I guess we're only going out for necessary shopping or things that we need. So, and a lot of people are staying home, working from home, or they're just no longer working, which is very bad for a lot of people. As for us, the health centre, we have to keep working because we come under Queensland Health, and yeah, like you say, Mulungu covers the Atherton Tablelands region, and we're doing our best to help our communities here.
If somebody does test positive through the regime that you guys are doing in the, you know, with the tent and so on, do you send them to Cairns? Is that the next procedure?
I think we probably send them to Mareeba Hospital, and then I guess, I'm not sure on the procedures from that point. They go to the emergency, or there's a station set up at Mareeba Hospital. If it's very serious, then maybe they're flown from the helicopter straight to Cairns base, which is a short flight away, and, you know, it's an emergency helicopter that through RACQ that comes up and down all the time. So yeah.
In Mareeba, there's around 20,000 plus people. I mean, there must be quite a lot of elders. Is there concerned with the elders in the community?
Yeah, so a lot of our elders, we're trying to keep a lot of them that are over 50 to stay home, as the Prime Minister said. You know, our Indigenous 50 plus clients, families, all should be staying home, staying safe, and avoiding the virus. And they should not be shopping. Maybe we should be sending out younger, middle-aged family members to do this for them. But we are creating food packages with you know, all sorts of stuff in there, like you know, tin of meat, braised steak. I haven't looked at all the food packages, but we were packing a whole lot of them yesterday and sending them out to the community around Mareeba and Atherton.
Yeah, so Atherton and Kuranda are like the next communities from Mareeba.
Yeah, so they're smaller communities just next door to us, and yeah, and we have small clinics set up in Atherton and Mareeba, Kuranda, sorry, yeah. So
as part of COVID-19, so you are setting up little hotspots so testing can be done in that particular case as well.
Yeah, I'm not too sure if we've got them set up in Atherton and Kuranda, but I'm pretty sure we do. That's part of our clinics. So yeah, our 2 small clinics would probably have some measures set up there. So yeah.
Does it surprise you the amount of numbers of positive cases now coming out of Cairns, especially knowing that it's we've filmed up there together many times, and there's a lot of backpackers up there, international travellers and so on, because Cairns is such a beautiful place. So no surprise that might be a hotspot over the next coming month or so.
Yeah, I think it's necessary to stay away from Cairns in town. It does look like a apocalyptic. Like there's not much people walking around and stuff. It's very, very silent. It's very unusual seeing a lot of businesses closed and less flights. You see people walking around and foreigners and stuff, and masks, and there's social distancing was the other one I didn't mention before about keeping your distance or wearing a mask or just being safe. The Aboriginal communities north of us and east, Yarrabah, Woodjal, Hopevale, they're all under lockdown. I guess only the locals can get in there, and essential trucks for like delivering food and medical needs and all those things that be important to those communities. So yeah, Yarrabah is under complete shutdown. They locked that I think a week or two ago, and yeah, only locals or necessary people can get through.
It's good that they did that too, isn't it? Because I mean, they jumped on the foot straight away instead of waiting for state government, federal government to say, hey, Aboriginal communities should shut down. I mean, they did the right thing. Yeah, we got the medical services there at Yarrabah and so on. So for them to get on the front foot and shut down, that was a good idea.
Yeah, definitely. To get onto those places early and shut them down will keep them safe, not just only in our region for like Yarrabah and Woodjal, Hopevale, all the other ones up in the NPA like Injinu, Bamaga, Seasha, Napranum, Doomadgee, Mornington, the Torres Strait Islands, and then you go down to the rest of Queensland like Warrabinda, Cherbourg. So as long as they're safe and locked off from the big regional places, then I think they're doing a really good job. And the health services that are helping them are doing a good job too.
Your health service comes under Quake, is that right?
I believe so. Quake and Queensland Health, yeah.
Yeah, so have you been getting messaging from Quake as well as obviously Queensland Health?
Yeah, they send us out resources and we just modify it for our community and stuff, and deliver it the best we can and try and help our community.
Yeah. How does it feel to be, one of these people on the front line, that's, is seeing this thing happen at the moment? I mean, it's just crazy times. I mean, I work at a university, and that's a different culture in the sense of someone like yourself on the front line of health, seeing and treating people who, could be affected by this horrific, virus.
I wouldn't say I'm frontline. Because I'm doing media and helping them promote the issue. I guess I'm helping in that way. But all my fellow staff, all 80 of them, separated amongst the 3 clinics, they're definitely in the front line in the reception and in the health rooms and setups, and the doctors, and they've got their masks and procedures, and they're up front with it, and they're limiting patients and stuff. So. And they're keeping a good eye on it, and I think we're doing a good job. Because for Mareeba, 2 cases in the town, that's pretty good amongst 20,000 Mareeba's population. So, and I guess so for Cairns, they've got I think 19 or 20 recorded. So, and compared, their population is probably triple ours maybe. So, and I think it's like you're saying, it's very hard for those who are not working and stuff, and those on the front line, and we have to keep working. And we'd love a holiday too, but it's serious, and we'll do what we can. Yeah.
Now, I know you love your National Rugby League, mate. There's no footy on. What are you doing instead? Because your team's not playing, and you watch some replays.
No, there's no football, no soccer, no netball, nothing. There's no local sport. There's no basketball, no local rugby league. There's no touch footy. Every sport is completely shut down. Pretty much all you can. Even the gyms are shut down. The pubs are shut down. Only things that are really open is cafes and supermarkets, service stations, hardware stores. even those look abandoned. So we don't have much to do apart from work or be home and stay safe. Yeah.
So your community's been affected by people shutting down their businesses and all that sort of stuff too. I mean, these regional centres. I mean, community thrive on helping and supporting the local community stores and whatever, but they had to shut down because of what the federal government has announced to make sure that we can control this thing.
Yeah, definitely. Most of them are shut down due to their staff numbers, I guess. They're keeping safe. A lot of businesses have had to shut, and some of them are lucky enough to work from home, and some are very unlucky to not be working at all. So, and we have like 80 staff, but we have measures to keep distance. We have meetings on Zoom, like here. So there'll be about 80 of us. It's like the Brady Bunch, all talking to each other through
the screens,
through a staff meeting.
So the next Zoom one you do, what you do is you look up and you look around like this, and it looks like the Brady Bunch. Yeah, you do that.
With the theory.
Here's the story.
Crazy.
Yeah. Hey, final question, mate. I'll leave because I know you've got still a lot of stuff to do. But there's been talk that they want to try. Obviously, Queensland wants to shut down the border from Northern Territory, New South Wales, and South Australia. And we've done that now. That's what they want to do. But there's been calls that we should shut down and isolate North Queensland from, the rest of us, sort of thing. How they're going to do that, I don't know. But that's been talk that they want to try and separate the top half of Queensland from the bottom half of Queensland. Have you heard any talk like that?
No, I haven't heard any talk like that. I don't know if I have the right to say it, but I don't think it would be necessary. Because they're locking down the Aboriginal communities anyway, and a lot of our communities and towns are separated from all those big places like Townsville, Rockhampton, Mackay, Cairns, and like all our small towns we're separated anyway. So,
it's separating anyway, yeah.
And I think everyone should stay in their locality and shouldn't be travelling and less necessary. And there's if it's an emergency like a funeral, there's funeral restrictions too, where people less than 5 or 10 can attend, I think. So I guess we shouldn't be traveling, but if it's family emergencies, then you have to look at ways maybe some can go, or it's just about isolating and staying safe, because we don't want the infection growing, and we don't want those numbers increasing. So it's all about those issues: sanitizing, getting your temperature checked, isolating from everyone, 1.5 meters. Transport, only a limited numbers of people going shopping, keeping your elders home, keeping them safe, looking after each other, not overcrowding houses, which is probably a tough thing for Aboriginal families, because we're big families and sometimes we have a lot of people in our houses. So just got to do the best we can in this crisis, and there's never been anything like this, I think, in Australia, in the world really, and it's worldwide. It's dangerous, and we have to stay safe.